improving breathing with vitamin D for COPD patients. Vitamin D, also known as the sunshine vitamin, is best known for its effects on the bone. But did you know it can also help reduce symptoms in patients with chronic obstructive pulmonary disease, commonly known as COPD? Studies have indicated that vitamin D has two important effects on the immune system that can explain why it reduces symptoms of COPD. Number one, it helps boost immune responses to respiratory viruses that often trigger COPD attacks. Number two, it dampens down harmful inflammatory responses, which help accelerate recovery and potentially limit the damage to the makeup of the lung. Patients with COPD are at an increased risk of osteoporosis, and so calcium and vitamin D may provide some help. Studies show that people with COPD often have decreased levels of vitamin D, a vitamin best known for its role in keeping bones strong. However, research has found that vitamin D may play an important role in respiratory health through its effects on lung development and structure, respiratory muscle strength, inflammation, and immune response to respiratory pathogens. A report in the journal Thorax found that 60% of patients with severe COPD and 77% with very severe COPD had blood levels of vitamin D below 20 ng per ml, which is insufficient. Some of the causes of having low levels of vitamin D may be genetic. Low levels of vitamin D may be attributed to inheritance of certain gene variants, which have shown to increase the risk of having low vitamin D levels, while another reason of vitamin D deficiency in people with COPD may be simply not getting enough sunlight. Since vitamin D is often depleted in patients with COPD, researchers wanted to see if vitamin D supplementation would have a beneficial effect on rehabilitation among the patients. So, for this study, researchers gathered 50 COPD patients with symptoms such as shortness of breath, coughing, and phlegm, which had been getting worse over time. Then they participated in a 3-month pulmonary rehabilitation program in which half the patients were selected to receive a high dose of vitamin D supplements once every month. The other half were given a placebo pill. At the beginning and at the end of the study, researchers tested muscle strength in the lungs and asked patients about improvements in their quality of life before and after the study. The results showed that participants taking vitamin D had a much greater improvement in respiratory muscle strength than those taking the placebo. Despite the fact that they could move and breathe better, study participants taking vitamin D did not report any improvements in quality of life. Currently, it is too early to determine whether or not patients with COPD should start taking vitamin D. However, researchers are tempted to start testing patients for vitamin D based on existing evidence. Whether a person will need extra vitamin D will depend on the climate they live in, how much time they spend outdoors, and how much vitamin they get from their diet. It is important to remember that every patient deals with their own kind of COPD. Therefore, it is not ideal to start taking vitamin D tablets without consulting a healthcare provider. For more information, visit a bureau and kickstart a healthy life. So, what are you waiting for? Soak some sun and get going.